Okay, then we have also here the von Willebrand disease. Okay, the von Willebrand disease is basically inherited as autosomal dominant trait, and there are three different types of your von Willebrand disease. So type 1, we consider that one sa quantitative defects. So pag sinabing quantitative, the problem with that ay mababa ang concentration ng ating von Willebrand factor from the usual to normal values. The type 2, on the other hand, we consider this one as qualitative. And the type 2, normal ang concentration ng ating von Willebrand factor. The problem with that is its function. So, ability to bind ang kanyang problem. So, we classify that one as either 2A. 2A is eventually caused here by mutation in your A2 domain. Okay, that one would be identified through your electrophoresis by the absence of both your large and intermediate multimer unit of your von Willebrand factor. Type 2B, on the other hand, is due to your mutation in your A1 domain, and that one will be identified by your electrophoresis by the absence only of your large multimer subunit, but your intermediate multimer unit is still normal. 2M, on the other hand, is the problem with the ability of your von Willebrand factor to bind with your platelets. So meron, as a review, there are two membrane receptor ng ating von Willebrand factor with your platelets. One is your GP1B95 complex, kailangan niya para sa kanyang platelet adhesion. And your 2B3A, this is needed for the platelet aggregation. So your 2M will be related to that, that's inability of your von Willebrand factor to bind to the platelet membrane sa dalawang receptor na yon. 2N, on the other hand, is problem with the ability of your von Willebrand factor to bind with your collagen, to bind with the factor 8. So remember that one of the receptor ni von Willebrand factor is your factor 8. So hindi siya makapag-bind doon, and therefore affecting the ability or the activity of your von Willebrand factor factor 8 complex. Type 3, on the other hand, is characterized here by complete absence of your subunits or complete absence of your von Willebrand factor 0. Wala talaga kang von Willebrand factor. Okay, remember that your von Willebrand factor is needed para mag-bind sa ating factor 8 concentrate to form factor 8 von Willebrand factor complex. So, if you have a problem with that, so it would also affect here your coagulation cascade clotting process. Okay, then we have here the different tests, okay, that we perform in order for us then to classify kung type 1 ba siya, type 2, type 2A, 2B, or type 3. Okay, so the first one, you try to perform here the quantitative na von Willebrand factor von Willebrand factor antigen concentration. So again, pag von Willebrand disease, we're expecting that mababa ang concentration ni von Willebrand factor. How are we going to know here if mababa ang concentration ni von Willebrand factor natin? Then you perform or you determine the concentration ni von Willebrand factor. So pag mababa siya, then that's your diagnosis of your von Willebrand disease. So there are several methods in order for us then to determine the concentration of our von Willebrand factor. One is your enzyme immunoassay. Other one we have automated. You could also perform here your latex immunoassay for the quantitative determination of the concentration of your von Willebrand factor. Another one, you could also identify, you could also classify your different von Willebrand disease classification as their von Willebrand factor activity. Pag activity, so that's measure, determine ability ng ating or activity ng ating von Willebrand factor to bind sa kanyang mga receptor. So, pwede siyang von Willebrand factor, restositine, cofactor. You have also your von Willebrand factor, CB, collagen binding, its ability to bind with the collagen, which is also one of the receptor ng ating von Willebrand factor would be the collagen. The third one, you should also measure the relative quantity of your factor 8. Because again, pag von Willebrand disease, since nasa complex si von Willebrand factor with the factor 8, usually pag may von Willebrand disease ng patient, mababa ang von Willebrand factor, and most likely mababa din ang factor 8 natin. Pero pag hemophilia A, ang problem lang ay sinasarili lang ni factor 8. Hindi kasali sa von Willebrand factor, when in fact, they are complex dapat. Okay, then we have here the test that could also help you to differentiate between your closely related na mga type. We have your 2A versus your 2B. You can perform here your low dose RIPA or your restositine-induced platelet aggregation test. Gumamit ka dito ng low dosage ng ating restositine and then try to measure the ability of the platelet to aggregate sa ganong concentration lang. So, gumagamit tayo ng 0.5 mg per dl na restositine. So, low dose lang, 0.5, less than 0.5 mg per dl. Okay, pag nagkaroon ng aggregation activity, using this concentration, that would identify your 2B. Pero pag wala, so hindi siya 2, so most likely hindi siya 2B. Okay, like we are considering for the 2A. Pag hindi siya nagkaroon ng aggregation response using the low dosage na 0.5 mg per dl na restositine natin. Again, your low dosage, it will only give an aggregation response in your 2B, but not your 2A. Another one, so again, your electrophoresis could also identify here or classify our von Willebrand disease according to the presence of their subunits. So, electrophoresis being carried on your SDS page or your sodium dodecyl sulfate polyacrylamide gel electrophoresis. So from there, we could able to identify kung andun ba si mga multimer subunits natin, large, intermediate, andun ba sila or wala. Again, the characteristic electrophoretic pattern of your different patient result here will help it to be classified according to type 1 ba siya, type 2, type 2A, 2B, or type 3. Okay, then we have also here the classification of your different types of our von Willebrand disease according to the different parameters. We have your type 1, type 2A, 2B, and type 3. Okay, so basically we have here in terms of their antigen concentration, von Willebrand antigen concentration, type 1 would have your low na antigen concentration, normal to slightly decrease in type 2A, normal to slightly decrease in type 2B, low to absent for your type 3. Another differentiation would be their activity. So pag sinabing activity, that's their ability to bind to the receptor, like for example with your histositine, with your collagen. So based on that activity, so type 1 will have your low, type 2A is low activity, then type 3 is low to absent. Your another one would be the ratio of your activity over your antigen concentration of your von Willebrand factor. So type 1 would have your more than 0.5, type 2 A2B. Okay, both of them would have your less than 0.5 na ratio of your activity and then antigen concentration. But then again, as what we have discussed kanina, they are differentiated by the low or low dose na RIPA at a concentration of 0.5 milligrams per DL, where your low dose na RIPA would be eventually will be having an aggregation response with a type 2B but not with your 2A. Then we have also type 3. So NA, since wala siya masyadong, diba? Remember that your type 3 is a complete absence of your von Willebrand factor and therefore you could not take the ratio of the antigen and the activity kasi wala talaga siyang antigen concentration, low to absent. The platelet count in terms of that, so normal, decrease, normal. APTT, slightly prolonged, normal, prolonged. Restositine-induced platelet aggregation, so we have here decrease, increase, absent. Factor 8 activity, we have here mildly low, normal, less than 5%. Another one, you could also perform your SDS page electrophoresis for you then to differentiate the different classification. For that, your type 1 would have your all forms are present. So, meron siyang large, meron siyang intermediate, multimer, subunit. Type 2A would be characterized by the absence of your large and intermediate multimer subunit. Type 2B would only have here the absence of the large multimer subunit. It would have a normal na intermediate na unit. Type 3, on the other hand, characterized here by all forms are absent. Wala siyang large, wala siyang intermediate. Is because, again, your type 3, we classify your type 3 as complete absence. Again, as the type 1 is the quantitative, type 2, both 2A and 2B are qualitative defects. So that's the defects in the function and or the activity, and type 3 on the other hand characterized by the complete absence of our von Willebrand factor. Okay, then we have here, we should also differentiate between your low von Willebrand factor activity and we have also pag disease. Kailan natin mako-consider na ang patient natin would only have a low von Willebrand factor activity and kailan natin mako-consider na may von Willebrand disease na ang patient natin. So, pinaka-cut off natin is 50% pag ang concentration ng von Willebrand factor natin is less than 50%. Okay, we consider that one as low von Willebrand factor activity. But if the concentration of your von Willebrand factor is less than 30%, then that would be already considered here as our von Willebrand disease. Okay, then we have here some of the factors we try to affect our test result when we are performing our von Willebrand factor assay, when we determine the concentration of that. First one, estrogen. So high-level estrogen will tend to increase the concentration of your von Willebrand factor. Most likely try to increase on the second, third trimester pregnancy. Another one, when the patient's undergoing here your hormonal replacement therapy, estrogen therapy na binibigay sa kanya or steroid hormone, ganon. Oral contraceptive. So that would tend to increase the von Willebrand factor level ng patient natin. So magiging false positive ang patient natin. Inflammation, so infection, post-operation, trauma, it also tend to increase your von Willebrand factor concentration. So stress, like excessive crying, yung kinakuha na ng dugo ang patient, pag-baby, so it also tend to increase the result. Another one, prolonged tourniquet application, so dapat less than 1 minute lang. So hemoconcentration also tend to increase the result of your von Willebrand factor. Another one, cold temperature will tend to decrease the concentration of your von Willebrand factor. Okay, then we have also here the treatment for your von Willebrand disease. So the treatment here is based on the bleeding manifestation. So if the patient would have here mild bleeding manifestation, the patient would have here treated as, okay, ito lang siya, RICE. So R stand for the rest, ICE. So pag medyo may, what you call that one, meron siyang hematoma, okay, so meron siyang trauma or pasa, then you could give ice, compression, or even elevation. Okay, for moderate bleeding on the other hand, that's is applicable for your type 1 and type 2A. So you could give here your estrogen, you could also give desmopressin acetate. Your desmopressin acetate, try to induce the release of your von Willebrand factor kasi nakastore siya sa alpha granules ng platelets natin. So, from there, kukunin niya para pumunta sa plasma and therefore, it would allow to increase your von Willebrand factor concentration. Your desmopressin acetate could be in the form of your oral, your desamino delta arginine vasopressin, or your desmopressin acetate here in the form of the nasal hinasinghod, so destimate. Another one, we have your epsilon aminocaproic acid as a treatment for that. And number 4, we have your tranexamic acid. But if the patient, for example, severe na kanyang bleeding manifestation, so salina na natin ang patient natin. Just in a case, for example, if you're type 2B and type 3 na patient. So you can give the patient with your human plasma derivatives ng mga blood products. So it contains here both your von Willebrand factor, also contains here the factor 8 concentrate. Sample for that, so itong mga preparation niya, you have your humanate P, aspanate, and we have also your Y-late. So itong summary natin for the therapeutic treatment na ginagawa natin. So for the type 1 von Willebrand disease and type 2A, you can give estrogen, IACA, DDAP, tranexamic acid as your primary options. But for your 2B, 2N, and 3, so pinaka-primary treatment na is the factor 8 von Willebrand factor concentrate. So aside from that, we have here another options. Type 1, 2A, you can give factor 8 concentrate. Type 2, B2N, you can give here epsilon, aminocaproic acid. And for the type 3, then pinaka-option niya is your platelet transfusion or with the transfusion of your platelet concentrate.